Okay, so this is week 11. We're doing health disparity and poverty, looking at a lot of the healthcare systems, kind of the challenges and the influence of those systems on occupational therapy. We're going to look at the bigger picture, what's going on with U.S. healthcare, and see how it trickles down, and definitely impacts what you're trying to do in terms of meeting your patient's needs on the OT level. These are the lecture questions for this week. This question 9 is like an in-class homework kind of assignment. It's due Friday, 4/2, April 2nd. You have to watch the short video and answer those 3 questions for around this video around hotspotters. We'll talk more about that in a second. Okay, so looking at the big picture contextually with healthcare in the United States, if you compare the U.S. to other countries with comparable economies, healthcare systems, in terms of the amount of money we spend, it's a ton of money compared to everybody else. It's almost like twice the average that we're spending in terms of the percentage of the gross domestic product, how much we economically kind of put out as a country. We're basically spending almost twice as much on average. Per capita, also, again, outstanding numbers. We're spending just a ton of money on healthcare compared to the average, compared to other countries. Where is all this money going? This chart shows that most of it is going into administrative costs. The amount we spend on administrative costs, comparatively, again, is just off the charts compared to other countries. 3 times as much compared to how much we spend in long-term care. But just this number is just stunning. Here's a good kind of anecdotal example of this. My wife used to work in a small hospital in Machias, the hospital down east. Some of you may know of it, Machias Hospital. So when she worked there during the week, this is a small rural hospital, very typical small area, it was hard to get a parking space. There was just not enough space for all the people that work there, so it was hard to park. When she works on the weekends, nobody's there. There's plenty of parking. It's like a ghost town. What's going on during the week is all those administrative efforts. The management, the layers of management is unreal. The layers of administrative assistants and secretaries is unreal. These aren't the people that are direct care people. Those are the ones working on the weekend. It's just a disproportionate allocation of funds. A lot of that is the increasing bureaucracy, increasing demands on what is required for reimbursement through Medicare and a lot of these insurances. It gets more and more complicated. Every time they pass a law, it gets more and more complicated. So you need more and more people to kind of organize it and help it. A lot of it, too, is the management culture. When management decides needs to make cutbacks, they don't cut back themselves. They cut back direct care workers. They kind of protect themselves, and it's like a snowball kind of thing. But bottom line is we spend way too much on administration in this country, healthcare-wise. How do we compare quality-wise healthcare outcomes? Life expectancy at birth, we're kind of near the bottom. Infant mortality, near the bottom. Specific diagnosis, unmanaged asthma, we're kind of in the middle. Diabetes, we're way towards the bottom again. Safety during childbirth, seems like a pretty fundamental thing, way towards the bottom. Heart attack mortality, we're pretty good, relatively good at that. This kind of pulls it all together, compares our healthcare to other kind of leading countries. Again, we are right on the bottom. So, bottom line is we spend more, tremendous amount more than other countries, but our quality of care is less. Spending more, getting less quality, spending more on administration, non-direct care, non-healthcare providers, spending more on managers, secretaries, not therapists, nurses, and doctors. Kind of breaking down even more specifically, France, which has a higher quality of healthcare, cost of one day in the hospital, $833 compared to $4,000. Hospital birth in the U.S., and we have that really low, a really high mortality rate comparatively. $10,000 compared to $2,600 in England. Total knee replacement, These are probably the same kind of needs, same kind of outcomes, but it's twice as much in this country as in other countries. So there's some people making a ton of money in healthcare, usually primarily around technology, MRIs, new knees, all kinds of stuff around that, and administration, CEOs of these large healthcare conglomerates, making astronomical amounts of money. Not so much the doctors, nurses, and therapists. The era of healthcare that we're in right now is called the HMO era, the kind of insurance, and it's really all about productivity. You're paid for the number of patients that you see, or you're paid for a diagnostic kind of group lump sum. You're not paid really, at least not yet. They're hoping to move towards that, but you're not really paid for quality. You're not paid for how well you do. You're paid for how many patients you see or how sick they are. What's really lacking is listening. Doctors, if you go to the doctor, I'm sure you've all experienced, they are under incredible pressure timeline-wise. They have to kind of crank people through really, really rapidly. So they need to get to the bottom of what's going on with you really, really quickly. So they need to diagnose, write a prescription, send you off to get a test. It's one of those two things usually. And they do that quickly. And what they're doing more and more so, and they've done studies on this, is they're not letting you tell your story, not giving you any time before they interrupt. It's like, this is dated, I think it's even quicker now. You have like 18 seconds on average with a doctor to tell your story before they interrupt, diagnose, write your prescription for a pill, send you off to get a test. There's very limited empathy. And we know the empathy improves the outcomes, does all these great things, but it's just lacking within this kind of bottom line focus system. Productivity, volume focused, test, specialist focused. That's where our system is very much focused on. There really is no cost control, limited to no. Cost bargaining that you see in other countries just doesn't happen in this country. Again, just certain providers, certain producers of technology and whatever are making a ton of money where the system is kind of lacking in the quality. Very much a defensive medicine, a lot of lawsuits, legal liability, chronic illness. We're going to talk more about this. This is like the future of healthcare really is chronic illness. What do I mean by chronic illness? An illness that can't be cured. As people live longer and we get better with our healthcare, ability to provide healthcare, people are living longer and longer and they're being sicker and sicker. Lifetime asthma. You have a stroke, versus in the old days you just pass away, you survive, and you're debilitated for your whole life. Diabetes is a classic one. Managing that diabetes, managing all these complications around illness related to the diabetes. Other things, mental health is another great example of that. The approaching tsunami is the baby boomers, and we're very silo focused. There's no kind of cooperation amongst different aspects of healthcare. So how does this kind of pay off down one with occupational therapy? Well,